complete details are here on that live. Vaccination. Do it actually need? Then how it help your child? What happens if you skip the vaccination? Complete details will be given. If any of you required any clarifications regarding Ayurvedic medicines and Keshruti hair oil and shampoo, along with that, I'm Dr. Here I'm prescribing medications depends on the concern, depends on the treatments which needed for a particular individual. First of all, before entering into vaccination, I want to clarify the doubts regarding Ayurvedic medications. If in allopathy, what is there means paracetamol will be the in general medication for fever. Whatever may be the age of the person, whatever may be the gender of the person, the paracetamol is the common medication there. But here in Ayurveda, that's not the condition. The authentic Ayurvedic medications will be given based on the complaints. First thing, based on the complaints. Next thing is based on the age limit and based on the Prakriti. This is the important. Prakriti means in Ayurveda there were three kinds of Prakriti: Vata, Pitta and Kapha. Okay, each individual is different. No two individuals might get the same medications. Okay, Vata Prakriti person, even if have same complaints with the Pitta Prakriti person, then the medications here will be the different. Okay, depends on the person, depends on the complaints, depends on the Prakriti and also the age, the medications will be given. So if one of your relatives went for an Ayurvedic doctor and he has prescribed some kind of medications to this person, depends on the complaints which he will say to the family and relatives that he has been cured from his sufferings, so use this medication if some others in the family have the same problem. But the condition here is this person is different than the other, so the medication might not work. There are 50-50 chances here. So you must not come to a conclusion that if one person is cured from his sufferings with Ayurvedic medications, then it will not work on other person if the Prakriti is different. Okay, so consult an Ayurvedic physician before using any kind of medications. We do have excellent medications for PCOS, thyroid and rheumatoid arthritis, osteoarthritis, whatever might be the condition, we also have a medication. And another thing I want to clarify is Ayurvedic degree is not a one which is easy to attain. Okay, we will complete 5.5 years of course. Here in this 1 year will be internship. Here you have to work in 6 months Ayurvedic clinic and 6 months in an allopathy practice. Okay, it is not that much easy. We will learn both Ayurveda and allopathy. So before entering into Ayurveda course, that is BAMS, firstly prepare well, because your mind might not be in a condition like I can attain degree of BAMS easy, because here in allopathy they will study only allopathy medications. In homeo they will study homeo medications along with some kind of Ayurveda. In homeo they will study both homeo medications and some kind of modern medicine also they will learn. In the similar way, Ayurvedic practitioners also will get both Ayurveda and allopathy knowledge. Okay, so we do have a knowledge regarding the modern medicine also. This is what I want to clarify. And without getting late, let's get into our vaccination schedule. I'll give the complete details regarding the vaccination schedule. And if any of you have doubts regarding any kind of Keshruti hair oil ingredients, and Keshruti hair oil is the one which came into market from our clinic, Sri Dhanvantari Ayurveda. Since past 5 years, we are giving this medication in general, and also depends on the complaint, we will modify the ingredients, and we will prescribe certain kind of medications to the individual, depends on his or her condition. Okay, if you have a general complaints like hair issues like hair fall, or else volume of hair will be low for some people, and with no scalp issues, if you have only hair concerns like whitening or graying of hair in early of age, at that time you can simply go with this Kesh Vriddhi hair oil, because it has a 27 ingredients with 12 secret ingredients. These 27 ingredients will be mentioned and we will say to you, but this 12 will be the secret ingredients which will not say to you, but they were added in one single bottle of Kesh Vriddhi hair oil to give you a certain kind of very good finish to your hair. Okay, this Kesh Vriddhi will give you a glowy hair, and your hair volume will increase. And if you have a complaint regarding the graying or bald or whiting early of age, then that will cure. Or all the thing which you have to remember is it has 27 essential ingredients for your hair and 7 essential oils along with 12 secret ingredients which will be useful for hair growth. No chemicals were used in this Kesh Vriddhi hair oil like almond oil and tila nuvul in Telugu, sesame seeds in English will be used, and along with that we will add on cow's milk for the what you have to say shininess, for adding shininess to your hair. Okay, the same things will be in Kesh Vriddhi shampoo also, with the added shikakai and some other Rita. Okay, so all the very good ingredients you will get in a single bottle. So if you want to use any kind of Kesh Vriddhi hair oil or shampoo, or else if you need any kind of treatment regarding PCOS or infertility cases were also treated by us, you can approach us and you can get a medicine based on your complaints, and there will be a regular follow-up of the medications also. Depends on the condition, depends on the improvement, we will prescribe the second dose of medication. We will not let the patient be relaxed after taking our medications. We will follow up what is the condition, how your body is feeling, and is there any improvement. Depends on all these conditions, we will give you the second dose. Okay, if needed. In some cases only first dose of medications will be enough for the patient to get relieved. Okay, now I am telling you the vaccination schedule. If you have any doubts you can ask, I'll clarify in this section. First thing, immediately after birth you will get BCG vaccination, OPV vaccination, and hepatitis B vaccination immediately after birth within 24 hours. Okay, if the baby didn't have any kind of complications like what you have to say oxygen levels are normal and his condition is normal, there is no need of any kind of nebulization at the time, the doctor will prescribe you all these, will give all these vaccinations immediately after birth within 24 hours. Next vaccination schedule will be at 6 weeks. For this time your baby age will be 1.5 month. Okay, next 10th month, okay sorry 10 weeks, first 6 weeks, 1.5 month will be the age. At that time OPV vaccination, Penta 1 vaccination, and IPV 1 vaccination, Rota 1 vaccination, and PCV 1. These are the first doses of vaccination which will be given at 6 weeks of schedule. Okay, next is 10 weeks, second dose of vaccination. That means at birth first, later on 6 weeks, later on 10 weeks. In this 10 weeks, you will get what kind of vaccinations is OPV second dose, Penta second dose, and Rota second dose will be given at the age of 10 weeks. Means at birth first vaccinations will be given, at 6 weeks means 1.5 month second dose, at 10 weeks means 2.5 months the third time vaccination you have to go, And I'm giving you that vaccination is the best gift which you can give your child. So without skipping this vaccination schedule, please let him or her take this vaccinations. It is the best gift which you give, because in future this vaccinations will help you to your kid with not getting into that particular disease. Okay, already the antibodies will be there with this vaccinations in your baby's body, so that in future if they were exposed to that particular kind of bacteria or virus, then these antibodies which you have already given to your baby through the help of vaccination will fight against them and let your baby be healthy, won't get into that particular disease. So vaccination is important, it will not harm your baby. Okay, if you have any kind of PHCs, village health clinics, or in AP and Telangana states Anganwadis, or else wherever you can get this vaccinations, you can go there and give your baby this vaccinations. Next, the fourth will be the 14 weeks. 14 weeks means here 3.5 months will be your baby age. At that time your baby have to go for OPV third dose, OPV third dose, Penta third dose, IPV second dose, Rota third dose, and PCV second dose. Is it clear? All this will be at the age of 14 weeks. Next vaccination will be at 9 months. In the 9th month span, you have to go for MR. Previously it is like MMR, mumps, measles and rubella, but recently from the time of 2019 or 2020, the government has changed that MMR vaccination to MR. Here measles and rubella will be given. If you have to get MMR, then you can go for private vaccination centers. uh, Actually the mumps cases were reduced slightly. Depending on that ratio and that scenario, the government had made this change to MR. Okay, next, if you want MMR, then don't take this MR vaccination in the government schedule. Skip this and directly go for MMR at private clinics. It costs nearly 2000 to 3000 rupees, depends on the clinic. Okay, next, JE vaccination. This is regarding the brain related issues and brain tumors and all. It is available in some clinics like Nellore and Karnool areas. This will be given. If this local area is exposed to that particular kind of diseases, then automatically the government supply will be there in that PHCs. Then they will give without asking. Okay, I am giving the clear details. 9th month vaccination will be the MR, JE1, and vitamin A drops will be there, which is good for your baby's eyes, so don't skip this also. IPV and PCV booster dose is the vaccination at 9th months. Coming vaccination will be at 16 to 24 months. In this 16 to 24 months, DPT booster and vitamin A second dose will be given. DPT booster and vitamin A second dose will be given. Don't skip this vitamin A, because that is the medicine which will bring your baby's eyes health very good. Okay, and later on 5 to 6 years and 10 years and 16 years will be the vaccination. In 5 to 6 years, your baby will get PCV booster. Again PCV booster is given here, and DPT second booster is given at 5 years. Okay, next, MR2 and TD vaccination will be given, and at this is at 10 years and 16 years of age. JE second dose. If you have already given first dose, then you have to go for the second dose, and TD vaccination will be the at 16 years of vaccination. Okay, now I am giving only names and months here so that you can get clarity. At 6 weeks, at birth, first time. Okay, next at 6 weeks, next at 10 weeks, next at 14 weeks, next at 9 months. Okay, this is the vaccination dates you have to remember. Later 16 to 24 months. At birth, I am giving you the names. Okay, BCG, OPV and hepatitis B. At 6 weeks, OPV first and Penta 1, IPV 1, Rota 1 and PCV first dose. Previously, before 2020 kids, PCV vaccination, for this you have to go for private clinics. It costs nearly 3,000 to 4,000 rupees. But as the lung disease cases are coming more in present scenario, the government has included this PCV vaccination under government schedule. So don't skip this vaccination. Give it to your baby. It costs 3,000, but you are getting for free at government schedules. Kindly know the importance of this vaccinations. This is the best gift which you can give your kid. Next, at 10 weeks, it will be OPV second dose and Penta third dose, IPV second dose and Rota third dose along with PCV second dose. Is it clear? Next, at 14 weeks, OPV third dose and Penta third dose, IPV second dose, Rota third dose, PCV second dose. This is at 14 weeks. By this, your baby will attain 3.5 months of age. Next, at 9 months, MR vaccination, JE vaccination, MR1, JE1, vitamin A drops. Here 1 means first dose. Next, IPV and PCV booster. Here some period of time you can get. Next dose will be at 16 to 24 months. At 16 months, DPT1 booster vitamin A second dose. And at 5 to 6 years of age, your baby will get IPV booster dose and DPT second dose, that is booster dose. And at 10 years of age, MR second dose and TD vaccination. And at 16 years of age, JE second dose and TD vaccination. It is the government schedule. Okay, in private clinics, you can get this kind of vaccination in between also. Like in 12 months, hepatitis A vaccination and MMR second dose will be given at 15 months. Varicella means the chickenpox vaccination and PCV booster dose, they will give at 15 months. But you have already given that in government vaccination. So kindly mark whatever vaccinations your baby has undergone. Don't repeat the vaccination. Okay, note the schedules, what you are given, what you have to give. Kindly note the mothers have to take this responsibility actually. Don't get blindly enter into the hospital. What the medications they are given, kindly note them, and then you can go for next schedule easily. Okay, in the next session, if you have any doubts regarding the vaccinations, or else if you want to know any more info regarding this, I'll provide that. Okay, and this is the first session. I'll come into the second session with the importance of Ayurvedic medicines and do they have any complications, and along with that, Ayurvedic medicines, do they have any kind of age limit? First thing I'll let you know in the next session is what is Prakriti, Vata, Pitta and Kapha. Everyone will say this Vata, Pitta, Kapha. What actually this? Okay, what is the importance, what is the role of this Prakriti in Ayurvedic medicines? And second thing, I'll let you know regarding the medicines, Patyas and Apatyas. Okay, Patyas and Apatyas means nothing but do's and don'ts when taking Ayurvedic medicines. Okay, does Ayurveda have any kind of external medications? Like, can you provide any kind of relief with no internal medications? Yes, they do have. Next important thing is, what is the role of Ayurveda in osteoarthritis and rheumatoid arthritis? And do you have any kind of pain relief oils like that? So many were asking. Yes, we do have the pain relief medications. This can be used both externally and internally. We will prescribe, depends on the condition of the patient and depends on the age of the patient. This pain relief oils and internal medications will be there, and I myself prefer first I'll give a kind of external medications like oil and lepas, and if needed I'll provide the panchakarma therapies. I'll suggest them, and all these were external applications. Okay, if the condition is worse, then Panchakarma therapies, I'll refer the patient to go with this, because here Vamanam, Virechanam and all, there will be 5 kind of therapies. I'll give the details to the patient. Okay, entire information cannot be given in the live sessions, no. So if needed, the patients will be given, and if they are okay with that, then they can go for PK therapies. If not, external medications like lepas and pain relief oils. Lepas means putamandu in Telugu, and along with that, Januvasti, Katibasti, like this, we do have external applications. They don't have any kind of side effects. They will nourish your bones and joints actually. Okay, but what you have to remember is, don't get enter into a coax, means non-Ayurvedic physicians, or else some people, they don't have any kind of knowledge on Ayurveda, but they do these all these things. So kindly go into a good clinic, authorized practitioner, and do follow the instructions given by him. For sure you will get relief. Ayurveda is the ancient medicine and the first medicine, you have to remember this. And we do will treat all kind of diseases, and only if needed we will prescribe internal medications. If not, with external applications only you can cure your disease. If any kind of info regarding Ayurvedic medicines do you need, means then you kindly WhatsApp our clinic number. We will provide you the details. Okay, this is what I want let you know. So thank you, and we'll enter in next session.